Gentlemen, I want you to imagine waking up tomorrow morning with the kind of firmness you haven't felt in years. No pills, no pumps, no risky treatments, just using your own hands and a few minutes of simple, precise stimulation to wake up your body's natural erection mechanism. And today, I'm going to show you 3 specific pressure points on your manhood and surrounding area that can help restore morning erections by improving blood flow, relaxing the right muscles, and boosting nerve responsiveness. If you've been missing that automatic morning rise, stay with me, because by the end of this video, you'll know exactly where these points are, how to stimulate them safely, and how often to do it for real results. Before we get into the where and how, you need to understand why this works, because once you know the science behind it, you'll realize you're not just pressing on skin, you're tapping into one of the most powerful systems in the male body. Erections are not random or mechanical. They are the result of a carefully coordinated dance between your brain, your spinal cord, your blood vessels, your nerves, and your muscles. It all starts with nerve signals, tiny electrical messages that travel at lightning speed from your brain or sensory nerves to the erectile tissue. Those signals tell the smooth muscles inside the penis to relax, which allows blood to rush in and fill the spongy chambers known as the corpora cavernosa. As they fill, veins that normally drain blood away are compressed, trapping the blood inside and creating firmness. Now, here's where age changes the game. Over time, the blood vessels in your pelvic region can stiffen due to reduced elasticity in the arterial walls, a process accelerated by years of wear and tear, mild inflammation, or conditions like high blood pressure. At the same time, nerve conduction slows, meaning those electrical messages from your brain or sensory receptors don't travel as quickly or as strongly as they once did. This double hit, sluggish circulation and weaker nerve signals, is one of the main reasons morning erections start to fade after 50 or 60. Targeted pressure point stimulation works because it sends an immediate wake-up call through your nervous system. When you press or massage specific points, you activate clusters of sensory nerve endings that feed directly into reflex pathways linked to erection control. These signals don't just stay local. They travel to the pelvic nerve plexus and even up to the spinal cord's sacral region, which houses the erection center. This triggers a chain reaction. The nervous system tells the smooth muscle in the penis to relax, the arteries to widen, and the blood to flow more freely. But it doesn't stop there. Some of these points also have a direct influence on the pelvic floor muscles, the hammock-like muscles that support the penis during erection and help control ejaculation. Stimulating them can improve their tone and responsiveness, making it easier to maintain firmness once you have it. This is why the effect of pressure point work is often twofold. It can help initiate erections more easily and also help you hold on to them for longer. When you press or massage the right spots, you're essentially bypassing some of the age-related slowdowns and giving your erection system a direct, hands-on boost. Think of it like resetting a computer, clearing the lag, refreshing the signal, and letting the hardware and software work together smoothly again. Done regularly, this type of stimulation can retrain your erectile reflexes, improve vascular flexibility, and even enhance nerve sensitivity over time. The first point we're going to target is called the base groove, and it sits right at the root of your manhood, the exact spot where the shaft meets the pubic area. To find it, run your fingers along the underside of the shaft toward your body. You'll notice a slight groove or indentation, almost like a natural hinge where the erectile tissue blends into the deeper structures anchored in the pelvis. This area might feel subtly different from the rest of the shaft, slightly firmer or more textured, and that's because it's a meeting point of important anatomical structures. Why does this spot matter so much? Beneath your skin here lies a dense network of sensory nerve endings, including branches of the dorsal nerve of the penis, along with key blood vessel junctions that feed directly into the erectile chambers. Think of it as a control hub where signals from your nervous system and circulation converge. By stimulating this area, you're essentially lighting up both your nerve pathways and your vascular system at the same time, encouraging better communication between your brain, your spinal cord, and your manhood. When you apply gentle but deliberate circular motions to the base groove, you're sending two important messages to your body. First, you're telling your blood vessels, open up and let more flow through, which boosts circulation. Second, you're telling your nerve fibers, wake up and get ready to transmit signals more efficiently. This combination primes the erectile tissue to respond more quickly when arousal signals arrive, whether that's during the morning or later in the day. Here's how to do it correctly. Position your thumb directly over the base groove while your fingers cradle the back of the shaft for support. Start with moderate pressure, enough to feel the tissue beneath your thumb, but never to the point of pain. Make small, slow circles, letting the warmth of your touch gently spread through the area. As you work, you can gradually increase the firmness of your pressure, especially if you feel the tissue beginning to soften and relax. You might notice a pleasant warmth, a subtle tingling, or even a sense of fullness starting to develop. Those sensations are your body's way of telling you that blood flow is increasing and that your erectile tissue is becoming more responsive. If you don't feel much at first, don't worry. Consistency is key. Over time, daily practice will heighten sensitivity in this area and make the results more noticeable. For best results, work on the base groove daily in the morning, ideally before you even get out of bed when your body is naturally relaxed. A warm shower is another perfect time, as the heat will already have softened your tissues and improved blood flow. Over weeks, this simple but precise technique can retrain your erectile reflexes, helping restore those strong, dependable morning erections you thought you'd lost. The second point we're focusing on isn't actually on the shaft itself, but in a slightly hidden, often neglected area, the perineum. This is that soft, slightly springy patch of tissue located between the scrotum and the anus. Many men overlook it entirely, but in terms of erection strength and control, it's an absolute powerhouse. Why? Because it sits directly above the bulbospongiosus muscle, a key player in maintaining firmness once you're aroused. The bulbospongiosus muscle is one of the main muscles in your pelvic floor, responsible for trapping blood inside the penis during an erection. Think of it as a natural clamp that keeps blood from escaping too quickly. Over time, especially with age, this muscle can weaken if it's not actively engaged, making it harder to maintain strong erections. By applying targeted pressure and massage to the perineal spot, you can reflexively activate this muscle, essentially giving it a workout without even doing a full set of Kegels. To locate it, either sit in a comfortable chair or lie back with your knees slightly apart. Using two fingers, usually your index and middle finger work best, press gently but firmly into the center of the perineum. You're not pushing hard enough to cause discomfort, but enough to feel the underlying muscle respond. Move your fingers in slow, deliberate circles, staying centered in that sweet spot. As you massage, you may notice subtle sensations building. Perhaps a gentle warmth radiating toward your penis or a faint pulsing as blood flow improves. That's your pelvic muscles waking up and your circulation responding. Spend 2 to 3 minutes here, keeping your touch steady and controlled. For an added boost, pair this with light pelvic floor exercises like Kegels, either before or after the massage. This combination doesn't just help in the moment, it trains the muscle to contract more powerfully during arousal, making your erections feel fuller and more dependable over time. The perineum may be out of sight, but when it comes to restoring morning vitality, it should never be out of mind. The third and final point is located at one of the most sensitive regions of the male anatomy, right beneath the head of the penis. This is known as the glans, and more specifically, we're targeting the ring-like ridge where the glans meets the shaft, called the corona. This area is packed with an incredibly dense concentration of sensory nerve endings. These nerves are your body's main messengers for sending arousal signals to the spinal cord's erection center. When this spot is stimulated with the right balance of pressure and rhythm, it can heighten nerve responsiveness, making it easier to transition from arousal to a full erection. It's almost like tuning up your body's arousal circuitry so it responds more efficiently when the time comes. This point works best when the stimulation is controlled. Too much intensity here can overwhelm the nerves and have the opposite effect. To work this area, gently take hold of your manhood with your thumb and forefinger, positioning them on either side of the corona. Lightly pinch the ridge and hold for about 5 seconds, then slowly release. Repeat this hold and release action for roughly 1 minute, making sure to keep the pressure firm but comfortable. After that, switch to slow, circular motions around the entire circumference of the corona, letting your fingers glide just enough to stimulate the nerve endings without causing friction irritation. This second minute of circular work helps wake up the sensory pathways even more, encouraging faster signal transmission between the penis and the brain. Over time, consistent stimulation of the glands ring in this moderate, rhythmic way can lead to stronger, more frequent morning erections. You may also notice an improvement in overall sensitivity during intimacy, making arousal feel more natural and spontaneous. Remember, this is not about overwhelming the nerves. It's about gently reconditioning them to respond the way they did in your younger years. Think of it as a daily reminder to your body of how good blood flow and nerve coordination are supposed to feel. The very best results happen when you treat these 3 points not as isolated tricks, but as parts of a single intentional routine. Here's the sequence I recommend to my patients for maximum benefit. Begin with the base groove for about 90 seconds, making those small, steady circular motions until you feel the area warm and responsive. Then shift to the perineal spot for 2 minutes, pressing and massaging in slow, deliberate circles to activate the pelvic floor and encourage deeper circulation. Finally, finish with the glans ring for another 2 minutes, using that hold and release technique, followed by gentle circular strokes to reawaken nerve sensitivity. Done back to back, this sequence stimulates blood flow, engages muscle support, and sharpens nerve communication, all the key elements needed for firmer, more reliable morning erections. Now, I want to set the right expectation. This is not a magic button that transforms things overnight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again. However, many of my patients start noticing subtle but encouraging changes within just 2 to 4 weeks. Improved warmth and fullness in the mornings, erections that last a little longer, and a general feeling of increased vitality in the pelvic area. For truly lasting improvements, pair this daily pressure point routine with healthy lifestyle habits. Staying well hydrated throughout the day keeps your blood volume and circulation at their best. Keeping your pelvic floor strong with exercises like Kegels adds to the firmness you'll notice from this technique. And don't underestimate the power of nutrition. When you make these steps part of your daily rhythm, the benefits tend to multiply. The points become more responsive, circulation improves, and your body begins to remember how to perform the way it once did. It's about creating an environment where strong, natural erections can happen more easily, and doing it in a way that's safe, drug-free, and completely within your control. Gentlemen, you don't have to accept weaker or disappearing morning erections as a normal part of aging. Your body still has the ability to respond. It just needs the right stimulation and support. By pressing these 3 points daily, you can retrain your nerves, restore circulation, and bring back that morning confidence without drugs or risky procedures. If you found this helpful, make it part of your routine and let me know how it works for you. And remember, your sexual health is a reflection of your overall health, so every step you take toward better circulation and muscle tone will pay off in the bedroom and beyond.